Right. Our speaker for today is Dr. Khadijة لحرش سلوان. She is a medical trainee and she holds a TESOL certificate in teaching English as a second language. She is also an activist in the field of volunteering and she has presented many workshops. She has presented many workshops in health and self-development, and she's also a talented content creator. And we're so happy to have her today to share her knowledge and experiences. Dr. Khadija will answer any questions you may have. Feel free to use the chat box for any questions or comments during the presentation, or you can raise your hand and ask your questions directly. Dr. Khadija, the floor is yours. Go ahead.
Thank you so much again for having me. Hello everyone, Assalamu alaikum. I'm so happy to be here today. I'm so happy to be among a team اللي كما هذا يعني a team اللي راح يسعى للتحسين والتيم اللي راح يسعى باش يقدم أفضل ما عنده بواش عنده، وهذا أهم شيء اللي لازم ناخذوه بعين الاعتبار. شكرا لحضوركم اليوم، وإن شاء الله هذه الحصة راح تكون مفيدة لكم وتدوا نظرة على الميديكال إنجليش. Without further ado، كما قلتكم وفاء، دايما الشات بوت راهي محطوطة، ممكن تقدروا تسقسوا كاع لي كيستيون تاعكم. اصلا لا سيونس راح تكون انتراكتيف، دونك وجدوا الشات بوت تاعكم باش راح تشاركوا معنا بزاف اليوم. Okay, so I think we will start. Okay. So راح نبداو بالgoals of the session. واش راح نتعلموا، واش راح تستفادوا من هاد السيشن. So first of all, you will learn essential medical vocabulary. Second of all, you will understand some common phrases used in medical contexts, and you will practice some communication skills of patient interactions. Okay, for today's session, I chose a topic اللي تعرفوها كامل. All of you, you know it, you know about it. So I want you to read the text. I will read it for you and tell me, in your opinion, على واش راح نحكيو today for medical English session. So it's a disease that brought about terms like social distancing, quarantine, and vaccines. The word came to a standstill and medical professionals became heroes. So what do you think we are going to talk about today? Yes, that's it. That's it, COVID. Yeah, that's it. Okay, yeah, it's COVID. سبتوها بالخف. Okay, yes. So COVID caused by novel SARS-CoV virus, and it is highly contagious. عقلوا على the word contagious. Remember the word contagious? Respiratory illness. So it was first identified in Wuhan, China in 2019, and it led a global pandemic. Remember the word pandemic. Impacting millions worldwide. So we saw the word contagious. What is the opposite of a word of contagious? What is the opposite of contagious? يلا في الشات بوت في المسجز يلا اكتبوا لنا what do you think the opposite of contagious ولا the meaning. إلا تعرفوا the meaning of contagious اكتبوا لنا in French. What is the meaning of contagious? Something that is contagious. Where are you? You're sleeping. I need interactions. It's spread. Sahara. Yes. Okay. Contagious. And the opposite. What do you think is the opposite of something that is contagious, or a disease that is contagious? I reveal the answer. By the way, رانا كامل هكذا. Yes, نجوى. Yes, you can talk. Or you can write. So I revealed it. So contagious, the opposite تاعها is non-contagious. معدي and غير معدي. So a disease that is really contagious, it means معدي, يعدي بزاف. Okay, and the opposite of it, we have diseases that are non-contagious. That was the first word. Okay. Now, if we talk about COVID, and if we talk about any disease, سواء يعني في أي لغة كانت, we talk about symptoms. We talk about symptoms. So what are the symptoms of COVID? I want you to write for me in the chat, whether you know the word in French or in English. Yes, symptoms is الأعراض. Exactly, and it's the same, Marcos, it's the same like as French. So it's the same thing. You say symptom and it's symptoms in English. So I need you to write for me the symptoms of COVID. Come on, yalla. Well, no. Even fever, thank you. Cough and fever. Even people from non-medical field. I'm seeing you. I'm seeing you and I'm waiting for you to answer. Hypoxia, thank you, Karim Ibrahimi. Cough, okay. Thank you, Wafa, for commenting. Yeah, it's cough. What else? What else? I need more. What's Jackum? What are the symptoms? Loss of taste and smell. Okay. Thank you, Wafa. We should call you a doctor. Okay. Fatigue. I love that. Okay, very good. Okay. فقدان الشهية والشم. Okay. That dying. Thank you. Thank you for that, but it's not a symptom. It's the end of the tunnel. Yeah, so here we have some symptoms. First of all, we have body aches. Body aches. When we say ache, we mean pain. So the word ache means pain. So body ache, it means all your body is in a painful situation. And we can say also sore muscles. Muscles مصغيرين. So sore muscles. So تفكروا also نقولوا headache. سمعوهم نقولوا headache or stomach ache. So ache means pain. Put it down, note it down. I'm telling you. And as you said, loss of smell. It's the worst thing when you can't smell your cup of coffee. When you can't smell your cup of coffee, I think that's the worst thing. We have fatigue, as Dr. Amin said. We have runny nose. We have breathlessness. It means shortness of breath. Shortness of breath. And remember هذه الكلمة, remember it, تفكروها. Shortness of breath. When we say shortness of breath, تفكروها, write it down because we're going to go back to it. And we have headache also. Headache. So حكينا على الأيك. شفتوا؟ This is a process of vocabulary building في English. في medical English, it's not that hard. لازم برك تعرفوا tricks and tips. So عندنا headache. الأيك قلنا it's pain. And الهاد say راس. So headache. We have sore throats. Okay, it means pain in your throat. We have sneeze. We have fever. قلت لي على الفيفر. Okay, fever. It's similar to French. You see, you can see medical vocabulary. It's not that difficult. It's not that different from the French vocabulary. We have fever. We have diarrhea. We have chills, as it's shown, and we have a dry cough. Remember? When we want to make like a history taking, we ask the patient about the cough. We say, is it a dry cough or a productive cough? You know, is it a dry cough or is it a productive cough? And when we say productive cough, what do we mean? Come on, medical professionals, tell me in English. Productive cough. Tell me. Yes, thank you. Thank you, doctor. That's it. Thank you for answering. Okay, so we talked about the symptoms. Any disease has what we call complications. So what are the complications of COVID? Tell me. Write for me in the comments, in comment section. What are the complications that we see in COVID? Come on, I'm waiting for your answer. Waiting to see your answers. Respiratory failure. Yes, that's it. That's one of the complications. Respiratory failure. What do we have also? Dyspnea. Okay. Blood clots. That's a very good word. Thank you. Yeah, thank you for that. Yes. So we have, and I brought for you just some of them. We have acute respiratory distress syndrome. Okay, I'm seeing your answers. So we have acute respiratory distress syndrome. We have acute liver injury. We have acute kidney injury. We have neurological complications. We have pregnancy-related complications. We have toxic shock syndrome and Kawasaki disease. And we have cardiovascular complications. Okay. There is a word that was repeated here, which is acute. Let's start by defining acute. What does it mean, something that is acute? And what is the opposite of something that is acute, or a disease that is acute? Yes, that's the answer. Acute means, yes, Dr. Salima, thank you so much for that. Yes, it's the opposite of a chronic disease. So when we say an acute disease, the opposite is something that's chronic. And for COVID, it touches many organs, like we have the respiratory system, we have the liver. Okay, the liver, and it's shown here. What does it mean, the liver? Call it the liver, and I'm repeating the word so that you can get the pronunciation right. So the liver, we have the kidney, or kidneys, we have the neurological complications again, and we have pregnancy-related complications. Yeah. What does it mean, pregnancy? What does it mean, pregnancy complications? Tell me in French. So tell me. It's okay to tell me the translation in French. We can accept that. Yes, pregnancy is lygosis. Absolutely, that's correct. And we have the toxic shock syndrome, which is a known syndrome after COVID. It's very known. And we have cardiovascular. It's the same thing as French, you see. So we say cardiovasculaire in French, and here we say cardiovascular. It's just you have to adapt to the pronunciation more. Okay, so as we said, acute, the opposite is chronic. Now let's go to the medical terminology. We have medical terminology when it comes to French, and we have medical terminology when it comes to English as well. And why it's essential for us to know it or to get to know some of the medical terminology, because it will help us understand, and it will facilitate for us the understanding of any word. So a medical word, it can be divided into 4 parts, let's say. So we have the word root, we have suffixes, we have prefixes, and we have combining vowels. And we will see a lot of examples concerning that, so prepare yourself to write a lot. The first example راح نجاوبها لكم وراح نبينها لكم كامل، بصح الآخرين وجدوا رواحكم وجدوا في الكلافية تاعكم باش تجاوبوا. So the first word is cardiology. Cardiology. So the word root is cardio, and cardio means heart. The suffix here is logy, and where do we see logy? We say the study of. So the meaning of this word is easy as it sounds, means the study of the heart. Are you ready to answer more? So if I tell you nephrology, can you tell me the word roots, the suffix, and the meaning? Go ahead. Doctors and even non-doctors, even if you're not a medical professional, you have to answer it. Waiting for your answers. So we have nephrology. Logy, what does it mean? It's like in French, study of the kidney. Yeah, that's it. That's it, Dr. Emmy. Yes. So we have the study of the kidneys. Yes, Dr. Selima, thank you so much. So we have nephro, which means kidney, okay? And logy, it means the study of, and the meaning is the study of the kidneys. We have another word, gastroenterology. Gastroenterology. So what is it? This is a specialty. Even if you're not a medical professional, I believe knowing these words is crucial, is important. على الأقل يكون عندك فكرة when you want study of gastronomy. Okay, you're close. You're close, Emmett. You're close. When we say gastroenterology, so gastro, it means the stomach, okay? Our stomach. Entero, it means our intestine. Logy, Yeah, about the digestive system. Absolutely, Najwa. And the meaning is the study of the stomach and intestines. So, gastro, whenever you hear this word again, you know that it's the study of the stomach and intestines. المشكل تاع أغلبية الجزائريين, let's say. We all have gastroenterology problems, isn't it? Okay, another word. Pyrexia. What does it mean? احنا شوية harder because of محجب. Yeah, because of محجب and a lot of things and many similar things. Okay. What else? Pyrexia. Who can tell us? Yalla. Yalla, tell us, what does it mean, pyrexia? You have to follow the same principle and try to guess. هذه واحدة من السيمتومز اللي شفناها من قبل. We reveal the answer? Okay, let's reveal the answer. So, pyro, it means fire or fever. Okay? Fire or fever. Whenever you see ia at the end, it means this is a condition. C'est une condition. It's a condition. And automatically the meaning here is a condition of having a fever. So pyro means fever or fire. Ia, it means a condition. And the meaning is a condition of having a fever. If you notice here, the word ends with an O. But هنايا قلعنا ال O. So كيما نقدروا نزيدوا a vowel راح نقدروا نقلعوا a vowel. علاش we do that؟ ماشي because of the meaning. It's not because the meaning يختلف لو كان نخلو ال O. ولكن ال pronunciation تجينا صعيبة. So the reason behind us adding a vowel ولا removing a vowel هو بالدرجة الأولى على ال pronunciation تاعنا. La prononciation باش تكون سهلة في النطق والتعلم. نزيدو more ولا خلاص؟ نزيدو كلمات ولا سيبون؟ ما عجبوكمش؟ I'm not seeing تفاعل. اللي نحبو. I'm not seeing very much تفاعل. نزيدو؟ Okay, more. Okay, let's see more. Okay, we have dyspnea. Yes, so we have dyspnea. Yell, dyspnea. Who can tell us what does it mean, dyspnea? عندها the same meaning كيما الفرنش. عندها the same meaning as French. dyspnea وقلتوها لي قبيلة. Yes, كريم إبراهيمي. We call you Dr. كريم إبراهيمي. Yes, shortness of a breath. ضيق تنفس. Yes, أمل, it's ضيق تنفس. dyspnea. Very good, excellent. So, for the word root, here, عندنا pnea. Pnea is the word root. And معناتها breathing. Breathing. Like when we say pnea, it means breathing. Here ما زادوش suffix, زادو a prefix. Prefix. So the prefix اللي زادوها هنايا هو this. And whenever you see prefix this, معناتها حاجة difficult ولا حاجة bad. Something difficult or something bad. So dyspnea معناتها كاين difficulty breathing. When we say difficulty in breathing, we say shortness of breath. Okay, هنزيدو more. هذه it's one of the main let's say symptoms اللي كانوا يجوا في الكوفيد. وكاين بزاف ناس اللي صار لهم لي سيكل يعني بقات لهم طولت لهم. اللي هي النوزمية. كاين بزاف ناس اللي طولت لهم هذه الأنوزمية. So واش هي الأنوزمية؟ Who can tell us what does it mean an anosmia? ديروا لنا the same structure. يعني word roots, prefix, meaning ولا suffix. So anosmia, loss of smell. Yes. Dr. Karim, you are revealing all the answers for them? Yes, that's it. Very good. So here the word root is osmia. Osmia means smell, the smell. N is without. Whenever you see الحرف أ ولا AN, it means without. So without smell, meaning تاعها loss of smell. So it's a person that lost smell. It happens a lot in COVID, during COVID. Hadi, another thing that's similar, agousia. What is it? Agousia. What is it? It's about the same principle. What do we say? It's a prefix actually. It's not a suffix, okay? It's a prefix. So is loss of sight. Okay, close. It's a loss of حاجة. صح شي لهاد الحاجة. Let's discover it together. Yes, of tasting. Absolutely. حاجة اللي the worst thing ever that we can experience when we can't taste our morning coffee. Yes, so an, it's not a suffix, it's a prefix again. A, and gousias means the taste, when we taste something. Yes, and the meaning of agousia, it means loss of taste. We can taste. And when you see this, you always say Alhamdulillah, like for these small things that we have. So, and we don't take time and then go to Alhamdulillah alayhum. So imagine that you can't smell or you can taste food for the rest of your life, and now you can. How would this be? So we just have to take a moment to say Alhamdulillah. Okay, another word هذه لازم تجاوبوني عليها. myalgia. myalgia. راك تشوفوا الماء الآن عارفوا بلي كاين. Yes, Dr. Karim, you're answering all the questions. We have to give you a page at the end of muscle aches. Wafa, you deserve a special certificate for you. Yes, so it means العضلات ولا muscles. Yes, it's the muscles. And we have a suffix here, which is algia. It means pain. It's not المفاصل, it's muscles, it's les muscles. So it's myalgia. Algia again is pain. Whenever you see algia is pain. واش شفنا تاني اللي قلنا it's a synonym of pain اللي شفناه الفوق؟ واش هو السينونيم of algia اللي شفناه الفوق؟ يلا tell me, let me see if you're with me ولا you're not. What is it? Yes doctor. Yes, that's it. So ache. قلنا حاجة similar to pain or a synonym of pain is ache. So here algia, we use it more as a suffix. And we say myalgia. Okay, we have another word which is emesis. Okay, emesis. What does it mean? يلا ورونا شطارتكم. يلا. You can write for us. Nausea. Okay. Nausea. Okay. Close. So MS, it means to vomit. To vomit. To vomit. And is هادي تاني معناتها a condition of. شفنا الفوق بلي حاجة واحدة أخرى نقول لها ولا السافكس نستعملوه to say about a condition اللي هو إيا. is تاني a condition تاع نقدر نقولو a condition is. So emesis, it means to vomit. It's another word ولا it's a synonym of vomiting. Okay, to vomit. I vomit. ما درناهاش في السيمتومز تاع COVID, but yeah, it's vomiting. Okay. خليني أوريت لكم الجواب. هذه I want you all of you to answer me because it's something اللي تعرفوها كاع. Tachycardia. يلا. What is tachycardia? حاجة tachycardia. أزمة قلبية. Okay, you're close. Yes, Farah. Yes, that's it. That's the answer. Heart rate over 100. Okay, Coach Sam, that's a very good answer. Yes, that's it. So we have tachycardia. I see. Okay, so for tachycardia, cardi again is the heart. Okay. Iya قلنا a condition of. Tachy, it means fast. So whenever you see tachy, it means هذيك الحاجة راهي rapid. خلاص؟ قد عندنا tachypnea. راح نشوفوها ما تاني. عندنا tachypnea وعندنا tachycardia. tachy حاجة معناتها راهي تمشي بالخوف، راهي fast. Abnormal, but abnormally fast heartbeat. Yes, very good, excellent, yes. So here, if we wanted to summarize the meaning, it's a condition of having a fast or rapid heart rate. So again, cardi is the heart, ia is the condition, and tachy as a prefix is fast. Now we have bradycardia. So you can guess, what is it? Bradycardia. We saw tachycardia and now bradycardia. You can smell the what is it? Yes, very good. Yeah, they're very good. Slow heart rate. Very good, excellent. I love your answers. Very good. Yes, that's it. Yes, so brady, it means something that is slow. So we have cardi, it means the heart. Ia is the condition. Brady, it means slow. Kima we have bradycardia, we have bradypnea. Okay, so wherever you see brady, it means slow. And it's a condition of having slow heart rate. So next time, especially for non-medical, for people in non-medical field, you can say, I have a bradycardia, or I have a tachycardia, instead of saying, I have al-khabab. So I have tachycardia. Okay, another word, like just to flex, you know, flex that you know some medical words. We have another word here, which is pharyngitis. يلا هذه على بالي باللي قاعد فيكم كاش واحد ما جاتهش، سواء كي كان كبير ولا كي كان صغير، ولا if you are a doctor you saw it in your consultations, you always see it in many symptoms. Yes, that's it. Yes, that's it. That's correct. The sore throat, yes. And it's whenever you see. So pharyngi, yeah, الpharynx. Okay. Itis, شوفوا, whenever you see itis, it's a synonym of inflammation. Okay, it's a synonym of inflammation. Inflammation. And it's the meaning, we can say a sore throat. A sore throat. So pharyngitis, itis, whenever you see itis, you mean inflammation. Itis, inflammation. Inflammation تاع الفارنكس. نقولوا pharyngite. So in French we say it. In English we have itis. Okay, we have more words. Now عندنا rhinitis. Rhinitis. What does it mean? Waiting for your answer. Rhinitis? Rhinitis, yes. Very good. It's one of the symptoms of it, actually, Majid. It's not a zukam, it's one of the symptoms of zukam. So, up. So, rhinitis, it means, when we say rhino, it means the nose. Yeah, and itis, it means inflammation. Inflammation. It's not الحساسية. It's inflammation. When your nose has an inflammation, and it will be like a runny nose, or we can say a congestion. So runny nose, it's easy, or rhinitis. Rhinitis. Okay. Another word will be, Hadi, you all know it, and yes. مجيد جاوب قبل طرح السؤال. هذا يعني إنه if you are not from the medical domain, we should give you a badge for being to be in the medical domain. Yes, so myocardial infarction. Myocardial infarction. Yes, your answers are right. However, maybe. Okay, I want you to tell me the same system اللي درناه, word root, suffix, prefixes, and the meaning. So, myocardial infarction. يلا. Myo is the muscle, cardio is the heart. Okay, that's... Yes. Infarction? Myo is the muscle. Very good. Very good, excellent. Yes, so you answered this right. So myo is the muscle. Action of stopping, that's very good, yes. Cardio, it means the heart. Infarct, it means a stuffing or an obstruction. You know, it's an obstruction in something. And when you see the physiology of a myocardial infarction, you understand that there is no blood supply to that muscle, so that we call it an infarction. So myocardial, هنا all is pertaining to. It means تعود على قلب, pertaining to. ش, it means the process, هذه it's as a suffix. And again, infaq, it means stuffing or obstruction in something. And the meaning of it, myocardial infarction, is a heart attack. And I think that we should all know, especially for people not from the medical domain, the symptoms of a myocardial infarction. You should all go to Google after this session and search for the symptoms of a myocardial infarction so that to protect yourself and your family. It's really important to know that, especially if you know someone who has cardiac problems. Okay, do you have any questions so far, or should we continue? Or should we stop? Should we do the case study or skip it? Let me see if you're here, if you're focusing with us, or you're not with us.
I guess we should do the case study.
Okay, let's do it. Everything is clear. Okay, no questions. Okay, let's continue then. Thank you so much. Okay. So you're a doctor at your desk when a patient walks into your office appearing ill. What's your approach? First things first, we have what we call taking medical history. You know, when your doctor asks you a question, it's not because he wants to lose time. He wants to take your medical history, especially for people not from the medical domain. So we take, yes, that's it, it's semiology. So we take medical history to get to know the person more so that we can proceed according to his history. So first of all, when the patients walk in, we have what we call introduction and consent. This is an important word for a student, for medical students, if you are a medical student in training. So yes, so we have consent, first of all. So we greet the patient in a good way. We say good afternoon, good morning, and you present yourself as a doctor. You say that I am Flan Fulani and I will be your doctor. It's semiology. Like we learn it in medical school, and we should not forget it. Because for me, a doctor who doesn't represent himself or herself to his patients, it's not like going to be very good. Second of all, you have to explain the purpose. Explain to your patients. Seeing your comments. Okay. Explain the purpose. Why are you asking? What do you want to ask the patient? Why do you want to ask the patient? So you can say, I'm here to ask you some questions about your health so that I can understand better your condition. And this is a very crucial sentence, and this is like an example that you can use if you want to speak in a patient in English. And lastly, we have the consent. The consent of the patient is really important. So, is it right if we proceed with the questions? So, in every patient, is it? If I ask you that, it's really important. And we call this consent. This is the word, this is the medical word. Now we have what we call chief complaint. why the patient is here. Why the patient is here. Yes, that's it. The patient must feel good from the moment he sees you. And I saw so many doctors when I was a patient, they don't act with me like that, and I'm not comfortable. I'm not comfortable from the beginning to the end, because simply maybe he didn't present himself, or maybe he didn't get my consent. Now we move to an important key point, a key point in taking a medical history, which is the chief complaint. Do you know what do we call it in French? Can you do the French translation for medical students or people in the medical domain? The chief complaint, motif de consultation exact, le motif. So we call it le motif. When asking a question to a patient, we have to try to say, what brings you in today? You have to ask open-ended questions. Not questions that are yes or no questions. Try our best to ask open-ended questions. Again, another thing, we have to note what's the patient's main concern. Concern, follow with me the vocabulary, because this part is all about, I know maybe all of you know this, but I'm focusing on the vocabulary. So the main concern, واش راح يقلقه, the main concern. So the patient will describe for you their primary reason for the visiting in their own word. So they would try to describe with their own words. So they will not say, I have dyspnea. They will say, I have shortness of breath, or I can't breathe. They will not say, I have tachycardia. They will say that I feel that my heart is beating fast. And here you will say, so why do I have to learn medical vocabulary the other way? Because we need it when we talk to other professionals in the domain. When you talk with your colleague, it's not the same thing when you talk to a patient. So you use different vocabulary or a more advanced medical vocabulary. Okay, now we have some grammar, some English, some grammar that you should know. Okay, okay, when a patient tells you, I have been having a fever and a cough, which sense is this? What tense is this? When I say, I have been having a fever and cough. I have been having. وش هو هذا التنس? Is it the present simple? قرأوا شوية English. Is it present simple? Is it the present continuous? Yes, teacher, yes. Yes, teacher وفاء نورمالمون ما تجاوبيناش انتي قلتي لهم الجواب شغل صايد. Yeah, so it's the present perfect continuous tense, and it's usually used to describe an action that started in the past and is still happening or has recently stopped. وهذه هي الحاجة when it comes to symptoms اللي تسقسيهم your patient. So يقول I have been having fever, يعني بداتها الفيغ بداتها صافي مثلا صافي 2 jours ولا 3 jours وبصح مازالت عندها دروك, so that's why جات عند الدكتور, that's why جات عندك. So I have been having, this is the expression that you can use, I have been having. And it emphasizes the duration or continuity of the action. يعني ما زلت يعني سواء حبست غصامه ولا ما زلت كاينة، ما زلت عندها هذيك الsymptom. For the structure, it's easy. It's have or has been plus the verb in plus ing form. كما I have been. The other verb can have. We're not having. So I have been having. I have been experiencing shortness of breath. I have been having trouble. For example, now I want someone to read for us. أنا حضرت بزاف قريت لكم بزاف. Now it's your turn. Let me see شكون راح نخيرو. Okay, who want to read first of all? Yes, Majid, please. Yes, Majid, you can read, please.
Okay, am I audible?
Yes, we can hear you. Thank you.
For the doctor, how long have you been experiencing these symptoms? Have you been feeling nauseous or dizzy lately? Have you been coughing for a long time, or is it recent? As for the patient, I've been feeling tired and weak for the past few weeks. I've been having a headache that doesn't go away. I've been coughing non-stop for the last 3 days.
Thank you. You must be a good doctor. Okay, so we have some examples of using the present perfect continuous in our discussion, whether as a doctor or as a patient. Now we need 2 people. For them, one will be the doctor and one will be the patient, and we will have like a simple conversation between them. You don't have to be in the medical domain to do the doctor. Maybe you want to try, and also just to chill a little bit and to have a little bit of fun, to have some fun. So who wants to be the doctor here? Who wants to be the patient? Who wants to speak? Wafa or Muhammad? Muhammad, do you like to be a doctor? Do you like to be a doctor or a patient? You have just to read. Okay, so Hajj's educational account. So you will be the patient. And who wants to be the doctor, please?
I'll be the doctor.
Okay, go ahead.
Okay, should we commence?
Yes, please.
Okay. Good afternoon, Mr. Smith. My name is Dr. Jones. How can I help you today?
We can't hear you very well. I don't know if the problem is mine or...
I can't hear him. Oh.
Hajj, we can't hear you very well. Can you mute your mic to talk again, please? No.
I guess he has a problem. I can do it instead if you want.
Okay, go ahead, Wafa. We would love to.
Okay, so I'm the patient.
Okay.
Good afternoon, doctor. I've been feeling really unwell lately. I think I might have COVID-19.
For that, let's go through some to get a better understanding for your symptoms. When did you start?
It started about 5 days ago. I first noticed a fever and a cough.
Can you describe the cough? Is it dry or predicted?
It's a dry cough.
Mm-hmm.
Yes, Mohammed?
Doctor.
Should I read another sentence because I didn't hear her?
I said it's a dry cough.
Okay. I have you any other symptoms like shortness of breath or fatigue?
Yes, I've been feeling very tired and sometimes I have trouble catching my breath.
Okay, that's very good. Now I want to ask you some questions to the doctor and the patient. Okay, we talked about fever and we gave it another word. Do you remember the word that we gave fever?
Honestly,
Yeah.
I
You're not a good patient at all.
don't. Okay.
Pyrexia. Yes. Yeah, that's it. Okay, what about shortness of breath? We gave shortness of breath another word. You can ask for help.
I guess it started with non-something.
It's dyspnea.
Oh, yeah. Sorry.
It's dyspnea. Okay. Okay, we will do another dialogue with two people, and then we will see. Now, who can do the dialogue? You see, it's very easy. It's very like, I need just two. You want to participate? Yeah, I need. You see someone? Yeah, Khalid, Sarah, you want to participate as a doctor or as a patient? What do you prefer?
The doctor.
I'll try. Okay, and you will be the patient. Go ahead. Try, please.
Right.
Can you repeat, please, Sarah?
Right. Have you noticed any loss of sister of now?
Okay, who wants to do the patient? Go ahead. Yes, Amal. Yeah, Amal, go ahead, please.
Yes, I can't taste or smell anything.
Have you had any other symptoms? Such as muscle ache, arthritis or congestion?
I have had
Congestion.
Yeah, that's it. That's it.
I have had some muscle aches and a bit of sore throat.
Thank you for sharing this. Have you been in contact with anyone who tested positive for COVID-19 recently?
Yes, a coworker of mine tested positive last week.
I see. Have you had any previous medical condition like diabetes, heart hypertension, or hypertension? No.
Or asthma, yeah.
No.
Or asthma.
No, I have generally been healthy.
Thank you so much. You're a good team as a doctor and the patient. Very good. Now it's
Thank
your
you so
turn
much.
to tell me. To tell me. We said loss of smell and taste has a word. What was it? When we say loss of taste. اسمينها angusia, yes. And what about loss of smell? What do we call it? Loss of smell? No? Something here. Yes, it's anosmia. Anosmia. Yes, very good. It's anosmia. Okay. Again, sore throats. We had another word for sore throat. What was it? What was it? Another word for sore throat. What was it? Come on, who can answer us? It's pharyngitis, absolutely. Yes, very good. And yes, pharyngitis. Okay. We have congestion or runny nose. How did we call it? Congestion or someone? It started with an R. So what was it? Double R. What was it? Rhinitis, yes, very good. Is something, that's good. That's very good, yes. Again, I saw something. Yes, that's it. Very good. And here we pronounce this diabetes. We often ask patients about their medical conditions, if they have any previous medical conditions. So this is the word that we can use. This is the expression that we can use. Previous medical conditions. Do you have or have you had any previous medical conditions like diabetes? Okay, I'm reading for you so that you can focus on pronunciation. Diabetes, hypertension, it means احنا نقول لها la tension, it's l'hypertension, and asthma, it's asthma. Okay, we have another part, like the last one. Like we are 15, so you can do it as the last one. We have some words here to end the session. Who can tell us who can be the doctor and who wants to be the patient? Okay, let me see. Yes, Amin, you can. Yeah, Amin and Hajj educational. Amin, you can be the doctor, and Hajj, you can be the patient if you want.
Can you hear me well?
Yeah, we can hear you very well.
Okay, how about me?
Yeah, we can hear. Yeah, we can hear you both very good.
Okay, thanks. All right. Have you taken any medication for your symptoms?
I've been taking over-the-counter pain relievers for the fever and muscle aches.
Thank you all for the information. Given your symptoms and recent exposure, it is important to get a COVID-19 test to confirm the infection. In the meantime, please isolate yourself to avoid spreading the virus and continue monitoring your symptoms. I also prescribe you medication to help manage the symptoms.
Thank you, doctor. I appreciate your help.
You're welcome. We'll get through this together. Take care and follow the instructions I've given you.
That was really good. That was really, really good. Amazing. Very good.
Thanks.
Good, very good team as a doctor and a patient. Very good team.
He did all the conversation.
It was a very good one. So let's see some words. So I have been taking over-the-counter pain relievers. So what does it mean, this expression? I have been taking over-the-counter. What does it mean? It's something that we do and we shouldn't do. You shouldn't do, and we should really raise awareness about it. Take medications over the counter. It's not overdose.
No, it means taking medication without a prescription.
Absolutely, doctor. Yes, it means taking medications without prescriptions. ولا نسميوها auto medications. It means you see that you have a fever, you go and you take a medication without prescription. And this sometimes can lead to overdose because you don't know the dose that you should take. So you should be aware. It's not auto medication. It's like you take a medication without another term, Algerian mothers. That's a great one. That's a great one. Yeah, Algerian mothers. You're tired, especially antibiotics. Like, I don't know if you're in the medical field, all of you, but especially antibiotics. Please do not take antibiotics without prescriptions because it's becoming to be like more and more common and it's fatal, really. Another word اللي هي isolate yourself. كيما على isolation and you know it شفناها بزاف في COVID هي بعد روحها كان الناس and to prescribe and prescription. To prescribe يعني نكتب لك l'ordonnance. So prescription c'est l'ordonnance. And that's it. Thank you so much. Did you have quarantine? Yes. It was the worst period ever. Okay, so do you have any questions, ladies and gentlemen? Do you have anything you want to ask? Anything you want to add?
Have you finished, Khadija?
Yes, I finished.
Okay, so thank you for this amazing session. Personally, I've learned so much today. And honestly, you made me like think about teaching ESP and be a doctor at the same time. For that. And we're so grateful for how you made everything feel like approachable and engaging. So now everyone, we have about 15 minutes for your questions. Just type your questions in the chat or just raise your hand and like talk directly to Khadija. Yes,
Thank you so
everyone.
much.
If you have any questions, just go ahead. Yes, Khadija?
No, I don't have any questions.
You have everyone saying thank you. You're gonna find the recording in YouTube, don't worry. The whole video. Okay, you're talking about the slides, I guess.
Yeah, no problem. I will share it with you and you can share it with them, no problem.
Yeah, I'm gonna share it in the group. WhatsApp.
For the doctors and patients, you're gonna be famous on YouTube.
Yeah.
Who did the roles.
Yes, do you have any question, guys? You have any question? Now it's the perfect time to ask.
Thank you so much. It's really yes.
Yes,
Emily,
you have a question.
you can ask.
Yes, go ahead, Emily.
Yeah, I can send you the references as well. I can send you. I can send the references to Wafand, or I can send you the references directly.
Yeah, I'm gonna share it in the group. Don't worry.
The doctor, I have a question.
Yeah, you can ask.
Can you tell the doctor that has OCD or those have a medical name?
Can you please repeat your question?
Can you tell my doctor I have OCD or does I have a medical name? Another medical name.
Yeah, it's we say it's OCD. Can you tell me what is OCD? Like the words.
OCD.
Yes, it's OCD, but each letter, what does it mean?
Like what?
It's obsessive compulsive disorder. Yes, that's it. It's obsessive compulsive disorder, and we call it like this in the medical field. It's OCD. Yes.
That's short name.
Yeah, but
Okay.
we can contract it. We can say OCD, but the name is obsessive compulsive disorder.
Okay, thank you.
You're welcome.
We have another question, Khadija.
Yes.
From Lحرش education account. I'm an English teacher. I'm willing to learn medical English in order to teach it. Do you recommend these sessions? Well, of course, but I want to share your thoughts.
For when it comes to ESP, ما كانش يعني really resources. It's your own efforts that you do. But you find the right resources and you accommodate the sessions على حساب your students or the students' need. So you see the group of students that you want to teach, you see their needs. Are they a group or that they want to focus on like speaking more, or they want to learn just the vocabulary and that's it? So it depends on the group. And when it comes to the resources, as I told you, ما كانش like a special program that you follow or special book that you follow. It's like you take from each book a little bit and you try to design your own course in your own session. I hope I answered your question.
Yes, do we have another question, guys? That is my English.
It can be, yeah, it can be. You have to put your own touch also. Thank you. As I told you, we have another question with of Majid. How do you design your learning curve when it comes to ESP? So it depends on the student's needs, as I told you earlier, and I try to see their level. I try to see what they want, and I try to see what is their goal. What do they want to achieve at the end of the course? And I try to tailor my approach according to that. ESP is English for specific purpose. I hope I answered you, Majid.
Yes, do you have another question? I guess, Khadija, that's it. Oh. Okay, so thank you, Dr. Khadija. By the way, the form link will be shared shortly in the chat. Yes, we have another question. Yes, Sihan. Yes, Siham, go ahead.
Thank you, Wafa. Well, I don't have a question. I just want to say that I'm so proud of you, Dr. Khadija. You are such a good choice, and you are really an added value for the initiative. Well, it's Sihan for the doctors whom I invited, and they're asking where is the person that invited us. So here I am. And as I told you, Miss Khadija, thank you so much for being with us. Thank you for accepting the invitation, and thank you for being that great. And I thank Wafa for choosing you because she did it great. It was really a very good decision. Thank you, guys. I'm so proud of you.
The pleasure is ours to work with a person like you.
Thank you so much. Thank you, Khadija. That was amazing. By the way, like I said, the form link will be shared shortly in the chat, so you can receive your certificate. Amal will share the link. You're gonna find like 3 questions. Just try to answer the questions so you can get your certificate. All right? Something else. What is it, Haja? We have another question. Yes, of course. شوف كل من انضم لينا اليوم لأول مرة لطور نفسك. طور نفسك هي مبادرة هدفها الأساسي هو تقديم محتوى تعليمي مجاني.
Wafa, just 1 minute. Wafa, please.
Yes.
There is a noisy, like annoying sound. I don't know if it's coming from you.
I guess
Okay,
it's coming
great,
from Khadija,
great. Yeah, it's from Khadija. Now it's fine. You can carry on. Repeat, please, because we didn't hear anything.
All right.
Go ahead.
I said لكل من انضم لينا اليوم لأول مرة طور نفسك هي مبادرة هدفها الأساسي هو تقديم محتوى تعليمي مجاني ومتنوع في مجالات مختلفة تهدف إلى تطوير الذات وتطوير النفس. لدينا المجال اللغوي where we focus on English، ولدينا المجال الاحترافي بكل أنواعه، لدينا المجال النفسي، المجال العلمي وغيرهم. عندنا كل يوم جمعة وسبت نقوم مؤتمرين. يوم الجمعة عندنا مؤتمر في المجال اللغوي كما اليوم، وعندنا مجال آخر يكون إما في مجال العلمي، الثقافي، الديني أو المرأة، يعني بالتناوب. وكل يوم السبت لدينا مؤتمر في المجال النفسي ثم في المجال الاحترافي. Alright, I guess I answered your questions. إذا عندكم أي سؤال على طور نفسك, you can like ask questions now. Will there be other sessions in the healthcare field? And yes, inshallah. We have like we're gonna have sessions in 4 skills in writing, listening, speaking, and so on when it comes to English, and we're also gonna have ESP. So we're gonna see Khadija, inshallah, in another conference. Wasn't that too? Yes, we changed it. بدلنا راه المؤتمر اللغوي في يوم الجمعة. المؤتمر الخاص بالمرأة والديني والثقافي ثاني يوم الجمعة. أمل, you want to say something, أمل?
Yes, just وفاء. رابط الشهادات نشارك في الجروب الواتساب. اوكي حالا لانه قاعدين
أمل معليش can you share a link تاع الواتساب هنايا باه يقدروا يدخلوا الجروب تاع الواتساب
لانه مفعل التسجيل. اوكي
I'll do it. Wafa, I'll do it right away.
All right.
Okay.
We have another question, but it's for you, Khadija. Do I need to have an ESP certificate in order to teach medical English?
Sorry. So no, you don't have to. You just have to تلم بالموضوع تاع هذاك ال ESP that you want, whether business, whether medical field. You just have to study it well, and you can do it. I actually don't believe you have to have a certificate to do something. If you want to really study something, or you want to give something to people, just do effort, study it really well. And YouTube is a source, is YouTube, ChatGPT, AI, whatever you want, and you can do it. So you don't need a certificate, no.
Thank you, Khadija.
Wafa, I just shared the WhatsApp group if you want to explain quickly to them how it works.
There is a WhatsApp group here, a WhatsApp link. Just join the group and you're going to find everything there. We'll send the link form for the certificate. You're going to find all the coming conferences. You're going to find also the link for the YouTube channel for طور نفسك. So please just join the group and you're going to find everything there. If you have questions, you can text me or text Siham also. Yes, do you have any question before we leave? Okay, I guess we have no question. We're gonna meet tomorrow in other two conferences. So في المجال الاحترافي وفي المجال النفسي. So I guess that's it for today. Thank you again, Dr. Khadija, and to everyone here. Goodbye and have a blessed night.
Thank you and goodbye.
Thank you, Khadija. Goodbye, everyone.